We spend about 5% of GDP on healthcare in this country. I was doing a little research to get ready for today. But the forecast is by 2032, we'll spend 20% of GDP on healthcare. Now, have the outcomes improved in the US? Of course they have. Life expectancy is longer, but we still underperform pretty significantly, when you look at the other large developed nations.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. Hello, everyone. Welcome back to Broken Benefits. I'm your host, Lee Lewis. Today's guest, so excited for you to meet him. He's a mentor of mine, Bill Allen. Bill is the former CHRO of Macy's and also Atlas Air. He's on the National Academy of Human Resources and has served previously on the boards of the American Health Policy Institute, the HR Policy Association, and was one of the founding CHROs and board members with the Health Transformation Alliance. So excited to have him on the show. Thanks, Bill, for joining us today.
Thank you for having me, Lee. It's great to be here.
Absolutely.
Great to be with you.
Bill, hopping right into it, tell us a little bit about your experience as it relates to healthcare and in particular, how your international experience influenced the way you view the management of American healthcare by large companies.
Well, I've had a bit of a journey in my career, from managing sort of benefits rollouts back in the mid 80s to moving into more senior roles, where I'm responsible for hundreds of millions of dollars in budgets. One of the things that, I really struggled with is, we're in a situation where, in one of my roles where, 2% of the lives were consuming almost 80% of the spend. And the question I asked is, well, how do we keep the next 2% from becoming part of this problem? And, we tried a lot of different things. We tried consumer-directed health plans, we tried wellness, and those numbers were pretty much outliers. I haven't seen anything quite that dramatic since then, and that was probably 25 years ago, but it really stuck with me. How do we ensure that, that we go from what we call a healthcare system today to a sick care system to keep people from falling into that bucket? And I've looked at a lot of different things, a lot of different ways of doing that. And quite honestly, I think we made progress around the margins, but we haven't made sort of really transformational progress. And so as I think about, the time over my career, spent 7 years in Denmark as also the chief human resource officer at Maersk, the big shipping company.
Yeah.
And one of the things that informed me over there is you've got, single payer healthcare, which is fine. It does provide a level of coverage for everyone. It is not sort of free as it is, sort of advertised here. It comes out of your taxes, which are dramatically higher than they are here in the US. But there is sort of a level of coverage that everyone gets, works pretty well. My experience, the only time it didn't work really well is a few cases where we had employees who were really ill, and typically what we would do is we'd find them, healthcare, somewhere outside sort of the single payer system. So there's trade-offs. There's no particular system that is absolutely perfect. We've got a lot of challenges here, which we can get into in a few minutes, in terms of the way we provide healthcare here. And there are things that I would encourage, chief human resource officers and heads of total rewards and benefits leaders to look at.
Everyone, now just a quick word from today's sponsor.
Lemonade for 50 cents. It's for a good cause.
This situation seems terrible, right? Well, what if I told you it actually happened in the United States in 2021? These are the families of people who work for companies just like yours. Give your employees 100% medical coverage with Catalyze Health.
One of the most common ideas that I hear out in the industry is, why is it that CEOs don't just charge forward, demand better, and get better results? Because we all know, at least those of us who are in the industry and spending a lot of time here, you can fix healthcare for an organization, you can flatten trend, you can create huge value, but very few organizations do it. And you've helped shape my thinking on this more than almost any other mentor. Would you mind sharing a little bit about the disconnect between, why is it that CEOs, CHROs, CFOs don't uh, don't always jump in and take a really active stance on healthcare?
That's a great question, Lee, and I think there's a couple key points here. Number one is that, and this is the way that I used to look at it, is if our spend increases within trend that you see in the industry, then you're sort of not losing, although you absolutely are losing because you're paying more and you're not really getting better outcomes. So that's one way to look at it. Another way to look at it is a more ambitious way, which I've seen some companies do. And, it was where we finally, sort of started to work on the Health Transformation Alliance, which we'll talk about a little bit more later, which is to say, okay, enough is enough. It's costing our shareholders, healthcare is costing our shareholders and our employees a lot more money every year for outcomes that are not any better. And the question you ask is the right question. So why doesn't that happen? Why doesn't it happen more often? There's really two reasons, Lee. The first is that the healthcare markets writ large is very, very complex. There's a lot of players. There's a lot of handoffs. Each one of those handoffs, incurs additional cost, and it's not very transparent. And it's not very transparent by design, because a lot of the way things work is sort of, not shared intentionally across, the client system. So that's number one. The contrast that I would share with you is that the country in which it's least expensive as a percent of household income to eat in the world is the United States. So if you look at groceries, if you look at takeout, if you look at restaurant, it's about 6.5% of the household budget, probably roughly around the same of GDP. Brazil, on the other hand, is 16.5%. There's other countries where 40%. Europe is more expensive. You can eat in the United States all in less expensively as a percentage of income than you can anyplace else. Why is that? There's a lot of reasons why. One is we've got a lot of arable land. Number two is we typically, historically, have had enough water to grow crops efficiently, et cetera. But the other thing is that the sort of supply chain is pretty straightforward. Okay. I mean, there's not, lots of hands in there in terms of, the PBMs and the insurance companies and the point solutions and
Right.
the hospitals and the physicians and the labs, et cetera. Okay. So that's number one. And, it's a pretty dramatic difference between those two supply chains. The second is that there's so much consolidation amongst the healthcare supply chain. So we all know the numbers. There's 3 PBMs that have 80% market share. There's 6 insurance companies that have above a 60% market share. I mean, you could go on and on. There's consolidation amongst hospitals. And some of that makes sense. A lot of it, in my opinion, doesn't, because there's not enough choices. If you're in Atlanta, and you're procuring healthcare for, a company with a large headquarters there, you've got limited choices. So the problem is you've got this very complex supply chain. You've got this very fragmented market with all of these organizations, companies, self-insured companies that are trying to procure healthcare in relatively limited markets. And, you've got the fragmented sort of demand side, and you've got a very consolidated supply side, very consolidated, which those two things create a situation where it doesn't really matter how big you are or how many lives you have. If you don't, it is almost impossible in these situations to have enough leverage in the marketplace to get dramatically better cost and outcomes. Now, are they going to be better around the margins? Yeah, they're going to be better around the margins. If you're big, but they're not going to be dramatically better. I mean, the cost curve, for many things sort of goes like this when volumes increase. Well, volumes are increasing and the cost curve goes like this. So sort of the complexity and the consolidation, I think, are the reasons why most people just say, you know what? If I can stay within the bounds of what's happening external to me and create outcomes that are at least as good as the market is providing, then, it's just too hard to go ahead and penetrate this sort of very consolidated, extraordinarily complex supply chain. So I think that's a big part of why, things don't change except around the margins. Does that make sense?
Makes a ton of sense, and I've never heard the analysis on the food supply chain and the cost before. This is absolutely fascinating. I I, I don't want to go deeper into that trail right now, but it's so interesting. Would you mind sharing a little bit of your change, because you very much understand that perspective because you held it for years, and then something changed and you shifted in the way that you approach this and have become a zealot for the mission of improving American healthcare. Would you mind sharing a little bit of your road to Damascus experience about sort of where you were before and how and why that changed?
Yeah, sure, Lee. And I'd say there are a couple things. Number one, the realization, back 20 plus years ago, 25 years ago, when I was sort of managing the benefits budget, at Maersk, for the U.S. Business, was the numbers were so crazy. It was like, 2% of our lives are consuming 80% of our spend. I was like, oh my goodness, it's 2%, then we ought to be able to figure out how to keep that the next 2% from coming in and, consuming a huge chunk of the resources. How do we do that? A lot of it was just very, very, very hard to get data, that we could actually do something with. So, we'll come back to that. The second piece was that, after a certain point of time, I said, I may be winning the battle, quote unquote. And the battle is, okay, let's go ahead and stay within sort of what the market increases are. But I'm losing the war because the costs for our shareholders and the costs for our employees just keep going up and up and up and up and up. And so I said, we got to do something different. I mean, what's the old Einstein's definition of insanity is doing the same thing and expecting different results. So, back, gosh, close to 10 years ago, and I mean, the whole backstory here is Kevin Cox at American Express and Kim Hoyer at Caterpillar and Mark Reed at Verizon and I, were the first 4 companies when I was at Macy's Inc. at the time, just to say, you know what, we're better together. We're better together because we are going to have more leverage with the healthcare supply chain, A, and B, the key piece of that was, which we talked about before, was data. If you don't have data to actually sort of address a problem, then you're not going to get very, very far. I had famously had a boss of mine saying the language of business is, sort of not Mandarin, it's not Danish, it's not English, it's not Spanish. The language of business is numbers. Mm-hmm. And data are numbers. And if you don't have the data, then, you're sort of stumbling around, in a dark room, tripping over things and falling over things and, trying your best and burning a lot of energy with not very, very good results. So that came to, us developing the Health Transformation Alliance under Rob Andrews' leadership, and you're a huge part of that, Lee. We're now at 70 plus companies with many millions of covered lives, and data on those covered lives all aggregated together to be able to see, what's going on on the demand side relative to the supply side, because economics is pretty simple. You got demand and you got supply. When you have a lack of transparency or too much consolidation on one side, the supply side, you get these imbalances, and what we suffer from is the imbalance between the two, and it results in more costs, average outcomes, and frustration. So, I'm full disclosure, senior advisor, to the Health Transformation Alliance, work with you very closely. Right. And what I would say is, that the question you've got to ask is, are you better off alone in this very, very difficult environment with tremendous complexity and tremendous consolidation, or are you better together with other like-minded people who want to make a difference? And I will say, being one of the first 4 companies to join the HTA, create the HTA, essentially, is one of the easiest decisions of my career, because it was a return on investment was huge, and quite frankly, it was literally the only way to create any leverage in terms of being able to ensure that our shareholders and our employees got better outcomes for the money, better value for the money that they were spending on healthcare for our company. Make sense, Lee?
100%. So Now your perspective has changed and you know you've got to do something different, getting out of the Einstein definition of insanity. What did you begin doing differently after once you secured and began receiving data and being able to analyze it? You have a benefit. You can't do it alone. You've got a benefits team with whom you've got to work on this. Maybe walk us through the steps that you took to start departing the status quo.
Yeah, um, it's like the old quote from years ago, the gangster, why do you rob banks? Well, because that's where the money is. Um, Al Capone, I think it was, back in Chicago, back in the old gangster days. Well, hey, listen, the first thing we did is say, where do we have a spend that is increasing the most? And how do we deal with that spend? And how do we get to the point where sort of the total cost of services that we're receiving, is the best fit for us as a company? So, I was very, very fortunate to work with some really good, folks who knew benefits very well. Bill Tompkins at the time, and then Joanne DeFino and Steve Braun. Were great. Steve was actually the finance player in the team, and incredibly valuable. Joanne knew benefits inside and out. And Bill, was somebody who, really did a great job in terms of helping me align the team and the company around, we've got to do some things differently. And, just the beginning there, we pulled about 12 cents a share out of our healthcare costs, um, and did it, without disturbing the organization or disrupting the organization, looking for the places where there was low hanging fruit. In that particular case, it was, all about the pharma contract, the industry leading pharma contract that we had, and still do have at DHTA. So, you really sort of think big. As one of my business partners at CEO Work says today, think big, start small, move fast, and win. So, we literally did that. We thought big, where's the opportunity? Start small, focus on pharma, move quickly, and then deliver the results and the return on investment that we had promised that we would deliver for our shareholders and for our employees.
A lot of employers say, even if I want to do something that is new and different, I want to move quickly. Uh, I have a challenge in that my broker or my consultant that we've had for a decade or more doesn't want to or cautions us against it or things like that. How did you overcome that if that occurred for you, and how would you suggest that other employers overcome that?
I think the first thing, it's a great question, Lee. The first thing you have to do is you have to ask yourself the question: are your incentives aligned with the incentives of the people that you have advising you? So, do they have skin in the game? Because you clearly have skin in the game. It's your job to be able to deliver on these things for your shareholders and for your employees both. But are the people who are advising you, are their incentives aligned with yours? If they're not aligned with yours, then try and get them aligned with yours. You win, they win, everybody wins. Or figure out a different way of going about getting people to advise you, because I find most of the time there's a conflict. And there's a conflict that is not because so-and-so is a bad person, excuse me, but because there's incentives that are differently aligned.
How do we help more CHROs have that change of perspective to start moving out of the keep it quiet, keep us in the herd, keep us in the guardrails, but to depart from that and say, no, we're going to intentionally do something very different here and we're going to get a better result?
Hey, listen, the CHRO job is harder than it's ever been. There's a lot going on. Um, I think if sort of writ large, if we don't do something different, then there's going to be solutions that are forced on us that we're not going to like. Okay. So figure out where healthcare is in your priorities, number one. Number two, be ambitious. If you don't aim high, if you don't think big and aim high and start small, then you're never going to change the status quo. But that's a decision that each CHRO has to make, and everybody is in different situations. And I would say the third thing, Lee, is when you talk think big, start small, ask yourself if you have the right resources to be able to move quickly when you need to move quickly. So I was extraordinarily fortunate. I had Steve Braun, who's now the head of benefits at Meta. I had Joanne DeFino, who's works with us at the Health Transformation Alliance, and she's a great link to the benefits lead community. And then we got Bill Tompkins, who's in a big total rewards job. I had the right people. The one thing I would say is we didn't do a bad job with communications, but we could have done even better than we did. We didn't really have a particular communications professional with us, in terms of how we communicated. So if you think about start small, big part of start small is, do we have the right resources to be able to move quickly? Moving is one thing. Moving quickly is another thing. And it's a combination of, have we boiled things down to the shortest path to value? And do we have the right resources to deliver?
Do CFOs and CEOs see healthcare any differently than do CHROs? They often will get grouped together. I don't know if that's fair to do so, or are there nuanced differences in how they approach healthcare?
I don't really think there's nuanced differences. Hey, listen, the CHRO's job is a difficult job, as I mentioned before. But one of the age-old things that never, ever, ever changes is that your job is to take problems off of your CEOs and your other colleagues' desk. Healthcare is a problem that, with the right mindset, can be taken off of the CEOs and CFOs' desk because they're the two other primary stakeholders. So as much as the job has changed, it remains the same in that your job as a CHRO or a head of total rewards or a head of benefits is to get problems off of your colleagues' desks. That's your job. So if you go back to sort of think big, start small, move quickly, it's understanding where are the opportunities, where can you make an impact, and how do you do that and move quickly by having the right resources in the right places. And I would tell you that one of the most powerful things about the Health Transformation Alliance is, number one, there's industry leading contracts. Number two, there's huge opportunities from a data standpoint. But number three, is that you have access to a network of like-minded people who are ambitious and want to make a change to the status quo. Because I said it before, I'll say it again, it is incumbent upon the leaders of large self-insured companies to make the change. Otherwise, the change is going to be forced on us, and we will not like it. It just is a fact, because if something is unsustainable, then it has to change, and the rate of increase in cost and is unsustainable. Full stop.
How did working for a retailer if at all, influence your thoughts about the way healthcare interacts with your employees? Because arguably, outside of like the DMV or the IRS, healthcare is one of the least consumer friendly, retail friendly experiences.
I would say, Lee, that it probably didn't change my mind about the quality of the interaction, because if you're in a shipping company or you're a captain in an airline company, or you're a store associate, um, you know you're a human being, and healthcare is important to you, and you're spending a lot of money on it, and it's important to you, it's important to your family. um what I would say is it probably didn't change it that much, simply because a human being is a human being, and sort of accessing healthcare is difficult in this country. Accessing healthcare that works best for you is difficult in this country. So, I would say it's a combination of really two things. Number one, the complexity of the healthcare supply chain, and number two, sort of the lack of transparency of it, but probably mostly driven by the lack of competition. If there was real competition, then and that would drive dramatic simplification, I think, um, through more transparency and the ability just to actually make it more user friendly. A better
Yeah.
user interface. Um, so
What are the ways, we mentioned earlier that a CHRO can't do everything him or herself. You mentioned that you had a great team that was able to help you do that. Uh, if you're a CHRO that wants to start making a departure, or an HR leader that wants to make a departure, uh, what if you've got a good team, but they just don't know what to do, or maybe you don't have the right uh, experience in that place? How can CHROs staff the organization so that they can think big, act quickly, and begin making real change?
well, I mean, once you understand what your ambition is, um, you know, and boil it down to the shortest path to value. Yes, you have to ask yourself, do I have the right people, in a very focused way, not sort of let's change the whole world, but what is that, priority? And do I have the talent that is going to allow me to take advantage of the shortest path to value? I remember one of my bosses many years ago who said, you have to raise the bar, and we don't raise the bar so people can walk underneath it. We want them to jump over the bar. Okay. But you don't do that sort of on a grand scale. You say, for these particular things that are going to deliver value, do we have, or can we procure the right talent to be able to do that? So, what I'm not talking about is, geez, I need to change out my whole XYZ function.
Right.
Just got to figure out if you have the capability to do the work that will bring the value. Um, and that could be that go out into the gig economy and find somebody who's done, one specific little thing really, really well, and you have them there for 8 weeks. I don't know, but it's being very, very focused on the value you want to create, the work that's associated with that, and then, do we have the talent, enough of the talent to be able to deliver that? So it's, you know, it is the way to be able to drive change, and to move quickly without sort of disrupting everything, because in most places things are working pretty well.
Right.
You don't want to throw the baby out with the bathwater per se.
Right. Right.
But you gotta have the talent to deliver the value, and that's clearly something that I've learned in my work with CEO works as well, which you and I have discussed before.
Focusing a little closer on, okay, I'm a leader, I have a team. I can't swap out all the people on my team. There's a lot of embedded expertise here, and they do a lot of things well. Nevertheless, we need to start doing things differently that we haven't done before. Many of the HR or the benefits managers and directors with whom we speak will say, "Hey, I would actually love to do things differently, but I've I don't feel like I'm in a position to where innovation would be celebrated. I don't know that they want us to do that, or I have a high aversion to risk because even small complaints can create noise." How can a CHRO change that culture in terms of innovation, risk tolerance, and creating a vision?
I think, Lee, the easiest way to do that is to have a serious conversation around the outcomes that you want to have in the future. So if you and I are sitting and having a conversation, about what our benefits programs are going to look like in 20 the call it the fourth quarter of 2027, and we have that conversation, and we look at the offering, and we look at the services that we provide, and then we look at the cost, and we say, are we okay with that? And if the answer is yes, then you're going to be okay with it. You're not going to invest in a different outcome. But if the answer is no, then it becomes a conversation around, okay, what are we going to do about it? Where's the value that's there? How do we change it? What is the work that's associated with that? And then do we have the talent to be able to deliver that? So I think, one of the key skills of any CHRO or head of total rewards or head of benefits is to say, here's what the future looks like if we don't do anything differently. And are we okay with that? And if you're okay with it, and that's fine. If say you're okay or you're not okay, if you say you're not okay, but it's not a priority, then nothing is going to happen. But if you say you're not okay and you prioritize sort of finding the value and understanding the work and getting the right talent on it and delivering the outcomes, it's a completely different story. So, it's really, really important to say, what do we want the future to look like? And are we okay with it looking like we think it'll look like?
Everyone, now just a quick word from today's sponsor.
The lockbox is a place where all of our customers' healthcare benefits data is brought together into a single location that allows us to then extract insight and have repeatable value built on top of it. There's so many different pieces of information that are floating around out there that it can be hard to know what's the important elements to pay attention to and what's the underlying noise that's in the data. So what I think we do that's really critical is we help bring our expertise and our experience in modeling to help our customers understand where the real value is that enables them to make the best decision for their member population that they support. For the first time, there's a commonly understood, centrally located data model that all of your different data sources can live and that you are able to trust the quality of, to trust the security of, and ultimately to trust the insights that you're going to get out of the data that you have.
One benefits team I met with made some evaluations, and we found a way to save, I think, $60 million a year for them. And they ended up saying, nah, we'll just pass because somebody might complain. And I asked, well, why is that the case? And they said, well, if I save $60 million a year, I might get a high five. But if one person complains, I could get fired. So they had no incentive to be able to make that difference. And that story has always stuck with me, just incredibly dramatic, the bifurcation there. And I wonder from your perspective, how is it that we can realign the incentives for the people on those teams so that they're measured by and expected and monitored to create great performance?
Well, I mean, I wish I could say that the example that you used, is a simple one.
Yeah.
It's not a simple one, because, clearly there's a very risk averse mindset in that organization, and not a very ambitious mindset. Um, so that's actually a really, really difficult one to solve as long as you have the sort of leadership that is very, very risk averse. And there's reasons why leadership is risk averse in organizations. I don't know any of the specifics or anything about this situation, but what I would say is that there is a problem in the organization because if there's a trade-off, and trust me, everything is a trade-off. Okay, there's no sort of have your cake and eat it too. All right. But there's a trade-off there that says we value having no complaints more than saving $60 million. Okay. That's just difficult. If I were the benefits folks there, I think I might try and think about whether it was the right place for me to be, right place be me to be spending my time. But everything is a choice, and that one is a clear choice there.
How might organizations?
Probably for good reason, Lee.
Yeah. I have to believe in that example that the leadership inside the organization doesn't realize that it may not even be that the organization's priorities are different. It's likely that there's a breakdown in communications, because I would assume that the CFO would be very interested in saving 60 million. They have no idea that's even on the table, and that the layers that exist are probably what's keeping them from getting anywhere.
Yeah, who knows? I mean,
Hard to say.
we don't know.
That's right. How do you think about realigning the way that we engage with the market to realign incentives? We've often said and heard if we could realign the market incentives and have a little bit of transparency around what we're getting for the money we spend, we could start to shift behavior very quickly. Although from the standpoint of the employer, it's hard to unilaterally make changes to realign the incentives of the system. Uh, but I'm curious your thoughts about some of the, think big, act small steps that we can start to take to realign incentives in the way we engage with the system more broadly.
I think there's a looming crisis in healthcare in this country. Um, and we could get into a long discussion about that. We don't have time to do that. Um, I think the power of a particular single company to be able to do that is very, very limited. It's been tried before. The only place that I know where it's sort of been successful in terms of heading in the right direction is the Health Transformation Alliance, which I spoke about earlier.
Mm-hmm.
70 plus companies now, you get to 100 companies, and if you get enough critical mass, people are going to have to start to pay attention. The fact, though, is that we're heading, we are cruising for a bruising, as my mom used to say. There's going to be a problem, and it's going to become a public policy problem. Um, and we're not very far away from that, in my opinion. So
That's right.
if I were to say there were three things that we need to do, you know, and they won't be done by any particular single company. Number one, to reimagine healthcare as simpler and more consumer focused. Number two is to re-engineer the system to be able to bring that to life. And number three is to realign incentives so that the payers, which include the shareholders and include the employees, have incentives that are aligned with the healthcare supply chain, which includes the PBMs and the insurance companies and the point solutions and on and on and on.
Right.
So I think those three Re's are the three things that, are need to happen. And if they can happen proactively, that's good. Otherwise, it's going to be difficult.
Yeah. That's, I think, a perfect thought for us to wrap on a little bit. Are there any other parting thoughts or advice that you'd want to mention that we haven't covered?
I don't think so, Lee. I think the sort of key to change is to think ambitiously, and to look into the future and figure out if you like what that future looks like, in a very specific way. So if you and I are sitting here having a conversation around the fourth quarter of 2027, going into 2028 plan year, are we happy with that? And are we willing to make it a priority to change? Because if it's not one of our top two, three, four, max five priorities, then nothing's going to happen. But if it is a priority, think big, start small, move fast, and deliver the results. So,
Love that. What are you personally doing next and working on? And if you're open to it, how might people contact you?
yeah, I'm sort of at the lovely point in life, and in my career where I call it my post-corporate career. An advisor to the Health Transformation Alliance, work with you and Rob and the rest of the team. I'm a senior advisor to the HR Policy Association. I'm a senior partner at CEO Works. And so I've got a number of things going on, a number of boards, but if you want to reach out, feel free to reach out at Bill at allenadvisorsllc.com. And or LinkedIn is easy. Just ping me on LinkedIn. Happy to
Perfect.
engage with anybody, but it's been delightful being here with you. Thanks, Lee, and thank you for all the work you're doing.
Thank you very much. This has been terrific. And for anyone listening, thanks so much for joining today's episode. If you've enjoyed it as much as I have, please feel free to share or send this to anyone, or especially senior leadership within organizations that might use this as a way to think through where they're headed and the incentives that are in place within the organizations as a catalyst to start making change. And thanks, and we'll see you next time. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible. Until next time.